Thank you, Grace. Thank you, panelists. We're going to move now to our last session with our Brazilian counterparts. I'm going to call Paulo Montagnere to join us and introduce the next panel.
Boa tarde, senhoras e senhores. É com prazer que eu digo bem-vindos ao Brasil.
Good afternoon, ladies and gentlemen. I haven't had the chance to welcome you in Brazil. I was not able to attend the previous sessions except for now. We're going to set the stage here. Secretary Paulo Januzzi was able to come back from his activity, and he's able to join us in this activity in order to take your questions, to entertain your questions from his previous conference. He's next door, and I hope that we're going to have a very interesting session. Let me tell you that we are very proud in terms of our experience of the Secretary of Evaluation and Information Management. We have a lot of experience working with policies. This is not the whole Brazilian process. This is just one single experience, the one we deal the most with. I love to work with practical experiences because we're able to see specific aspects that help us move forward just because we incorporate them in our daily activities, and some other times because we realize that when we are going to work with the day by day after day of continuous policies, not isolated projects or programs, but continued policies, we have to act in a different ways, different from the one that we planned when we are working with one specific and isolated action or program. This is our main contribution to the debate. I would like to invite to the stage our colleague Alexandro Rodrigues Pinto, who is an acting director of evaluation, and he's responsible for the program Bolsa Família, as well as for the evaluation of that program. He's going to get started with his presentation, and after that, well, the other colleagues of the panel have just arrived. I would like to invite Cecília Lariú. She's one of the coordinator of impact evaluation that we conduct in the research. Luciana Sardinha, who is also a general coordinator of demand research and evaluation demand, so that you have an idea of the different working areas. And of course, Paulo Januzzi, our secretary, that you already know from yesterday's session, and he will join us today. Alexandra, would you like to start? Okay, we give the floor to Alexandre. If you think that we're talking too fast, please let us know, make a sign, and we will try to speed down. Thank you, Paula. Good afternoon, ladies and gentlemen. I would like to tell you that I'm very pleased to be with you, sharing our experience in evaluation. I'm going to speak in Portuguese because I feel more comfortable, but if you feel disappointed because you are not listening to my bad English, you will have the chance to listen to me tomorrow. I will speak in English tomorrow. Well, in my presentation, I will try to answer this question that was posted: how evaluations can influence Brazilian programs, and I'm going to refer to Bolsa Família program. As Paula reminded, we are going to speak about some programs. We belong to a sector ministry, and in our secretary we use the research, and I'm going to show you some of the researchers that we hire in the secretary, but at the same time we use researchers that are produced by the national statistical system. I'm going to split my presentation into 3 parts. First, I'm going to contextualize the Bolsa Família program so that you better understand the evaluations, and afterwards how the evaluations contributed to the progress of this program. In the second session, I will tell you about the evaluations conducted by Bolsa Família program. I'm not going to detail the results of those evaluations. We would need a much longer seminar, and this is not the main goal of this panel. In the third session or part, I will try to answer this specific question. Maybe I'm going to raise more doubts than answers to this question. The secretary is telling me to speak slower. I will try to do so. Before speaking about the Bolsa Família program, it is important to speak about the wider program, or the umbrella, which is the unique registration system. It is an instrument to collect data that is used in order to identify the beneficiaries of that program. Differently from many people believe, both in the academy and also in the management, this unique registration system is not a registration only for Bolsa Família program. It is used also for the program, but as I'm going to illustrate later on, this goes beyond the Bolsa Família program, and this is used by other areas. Our colleague Marcelo Cabral explained the Bolsa Família program, and you have seen yesterday that the program is used by more than 20 programs in order to identify the target publics or public target audiences. And we have a great potential for research. Who is the target audience who can register in the Bolsa Família program? Families with an income of up to 1,000 reais or up to 3 minimum wages in total. That is 1,500 reais. That is about $750 per capita. Today, the Bolsa Família program assists over 23 million people. Out of them, 13.8 million are beneficiaries of the Bolsa Família program. As I said before, what are the main purposes of this unique registration? The first goal is to identify the characteristics of poor families and their members through the social identification number. Each family that is registered in the unique registration receives a unique ID number, and by using this ID, we are able to raise some information that we can cross with other databases that are available at national level. Different from other countries, in Brazil, we don't have a unique ID number. We have the people ID number. We also have a number for as a taxpayer, which is the CPF, and we also have social programs ID. The unique registration program has this NIS, which is the ID number, but for the healthcare system, for example, we also have a unique number. We are trying to put together some tables. When you have a piece of information, you can have access to the other databases. I may tell you that this is a major challenge because the systems were not built that way. We are just working and using the whole information, and besides that, the name of the parents, date of birth, and other pieces of information in order to identify those families. What kind of information is in that unique registration number system, which can be used as data source for research purpose? We can see characteristics of the families, the household, the soil or the floor, if it is cement floor or not, how many pieces does the household have, how many people live in that house, what's the income of each member of the household, etc. And this is the declared income. Marcelo yesterday elaborated on that subject. We don't use other means in order to calculate income. We really believe in the income that the beneficiary person declares. And we can, of course, compare our situation with other countries that uses this kind of registration. There is not a lot of advantages. Our error of inclusion are not larger than other countries that use this registration, and the methodology is much more complex in the other countries and, of course, much more expensive. We also conduct some audits. Different audits show that there are some cases of frauds. Of course, in such a huge database, it is impossible to prevent them to happen, but we have a systematic declaration of the income. In the same database, we have the school level of each member of the household, professional situation, so we are able to see the occupational situation of those beneficiary persons, the income and expenses with the families, with the household. Now, who conducts this unique registration? What's the governance implemented? The federal government set the rules and the standards for this unique registration. The municipalities conduct the registration, and the state government level, they are responsible for the coordination, training, and support to the municipalities. The federal government transfers their resources to the municipalities for this registration. They pay for new registration, and also they pay for municipalities that have to update the database or improve it. This way, we foster a better or improved management of the registration. According to the law, the families have to update the data until 2 years or every 2 years. It doesn't mean that all the families have their data updated every 2 years. Part of this database is not updated because the family that receives the Bolsa Família program, if they do not update the data, they are going to suffer a cancellation of the program. However, those families that do not receive the program are not interested in updating their data in that unique registration. Only if they are going to have access to other social programs, they have to update this unique registration. I'm going to give you more details about other initiatives because we have a mechanism. The state is not going to be passive in that relationship. They have an active relationship with the beneficiaries in terms of their registration. Let me tell you about some programs that use this unified or unique registry. The main user is the Bolsa Família program. Besides that, we have the Green Grant program. Marcelo Cabral spoke yesterday about this Bolsa Verde program. This is a way to incentivize the conservation small producers in the farm. They are urged to preserve some conservation areas. The PRONATEC, which is the National Program of Technical Qualification, Marcelo also yesterday told about this. My House, My Life program. We have housing deficit in Brazil today that we have been trying to correct by means of this program. My House, My Life, Minha Casa, Minha Vida. This housing is subsidized by the government to low-income population. And these all social programs use the unified registry. We cannot get into detail about each program, but we have also a social security with a complex network of services rendered to the population. The Cistern program. Cecília Lariú is going to speak about this program later on. The program Alphabetize Brazil, and also the electricity social fee. This is a reduction of the electricity fee for these low-income beneficiaries that are registered in the unified registry, of course. As I told you before, there are more than 20 programs used in the unified registry. Paulo, can you control my time, please? Okay, let's move on. We're going to speak specifically about the Bolsa Família program. What's the program about? It's an income transfer program. I'm going to tell you about the conditions. The income is transferred to these families, and I'm going to tell you about the profile or characteristics of these families that receive the Bolsa Família program. The main criteria in order to define whether the family is poor or not: 70 for extremely poor, 70 reais as extremely poor, and 140 reais as poor family. Organization and decentralized implementation. These are some of the characteristics. The registry I was already introduced. This is managed by the municipalities or city halls. We have some researches showing success, and because of that, the management of the program is done partially by the national and part by the municipal government. If you have some questions, we can go deeper on that. We have a centralized institute for management. The program fosters the coordination between the national, state, and municipal level. Previous programs used to work directly with the beneficiaries, and that's why we have this coordination at national level. This fosters the coordination between the different players. The program is not limited to some expenses. Previous programs had this limitation. The program or the family should use these resources in order to buy foodstuff. The Bolsa Família program does not set this limit. We believe in the freedom of families to choose whatever is better to their families. The program is totally financed or funded with the federal budget. There are no other funds involved. Once again, this is a chart or the graph, one of the tools presented by Paulo yesterday. This is public domain. These are the data of the progress of number of families registered in the unified registry. As we have seen before, we have over 23 million families registered in it. I'm running out of time, so I'm going to skip a couple of slides. These are the numbers of Bolsa Família program. We started with less than 4 million and we reached 13.8 million. This is the progress of the amount of the benefit or the grant. We started with 72 reais all the way to 152 reais, more than double the amount in the last years. This is the evolution of the budget implemented in the Bolsa Família, reflecting the other variables that I mentioned before. In terms of GDP, this accounts for low numbers. These are the numbers of the Brazilian GDP. In 2011, it was 0.4% of the GDP. In 2013 is 0.5% of the GDP. So relatively speaking, in terms of the GDP, the program is very cheap. A last remark, the recent progress of the Bolsa Família with a new benefit to overcome extreme poverty. The Bolsa Família program did not take into account the gap of poverty. So we transferred a fixed amount according to the composition of the family. Now we started to take into account that composition. In January 2001, we reached over 20 million. In 2011, with this new criterion, we kept the same logics. In 2012, with the program Brasil Cariñoso, Tender Brazil, we started to work with this logic of reducing the gap of extreme poverty in households with children. And in 2013, the same logic is expanded or reached out to all the families. We don't have time enough to speak about this in detail, but this is just a new way for the state to deal with the population. The state is no longer a passive player waiting for the family to come to the service and start looking for the families where the families are located to bring the benefit to them. These are the conditionalities of the program. We have three main conditionality: health, education, and social assistance. The goal is to guarantee a social protection system for the families. I'm not going to get into detail of the service. I'm just going to present the number of surveys that were already conducted. All the surveys that I'm mentioning here were conducted by our Secretary of Information Management. Other surveys are conducted by the ministry. Our secretary, 80% of the surveys are hired externally, and we speak a lot about the trust and credibility of the survey. Exactly betting on that, we try to avoid to conduct our surveys, our own surveys, except for some cases where we need an immediate result. And you know that the hiring time, for hiring an external agency requires time, and sometimes we don't have it. We commissionate the survey, and that's why we want to consider a very important variable. Sometimes the decision-making process depends on an immediate result of a survey. Trying to answer this question before examining the factors, it is important to take into account some aspects or codependent variables of things that we already have to pay attention to when we are going to see how the evaluation can have an impact on processes. If you work with an evaluation, you have an expectation, and you want the evaluation or the recommendations to be applied by the managers. If you work with the evaluation, you know that this is not true in all the cases. There are other information sources that are as legitimate as the evaluation presented to the manager, and the manager can use the other information sources. In 2010, we did a meta-analysis or research or survey in order to answer that question. How our evaluations are influencing, if they were influencing the decision-making process, and what factors were involved. One of the factors that highlighted is that by the time to communicate the recommendation, by the time to communicate the result of the evaluation, to take into account the organizational culture, the ministry is coming from 3 different government structures, 3 different, very different organizational structures, and very often we don't take into account the organizational culture when we are going to communicate or to present their evaluation reports or recommendations. We deal with that as if it is only one single organizational culture. We use some technical terminology, for example. We use methodologies to communicate that are very technical, and sometimes the communication is difficult. It is difficult to insert the evaluation in the decision-making process. This is one of the factors that we identify, that is to take into account the organizational culture. In this survey, or meta-evaluation, one of the recommendations was to use the public policy councils, as we call it in Brazil, as a deliberation and decision-making spaces. We wanted to use these councils to present the evaluations and to gain more champions or partners when defending their recommendations. So, besides presenting to the managers, we wanted to use the councils too. The sense of belonging of the evaluation was very important too, the ownership sense. And this takes into account, for example, the participation aspect. The more we can involve all the players, all the stakeholders that are going to use the evaluation, it is important that they feel as belonging to that evaluation. Sometimes they don't know about the potential or limitations of the evaluation. They are going to get familiar with it. The result of the evaluation is not going to be a surprise for them. Very often we saw that we presented an evaluation report. The stakeholder could like or not the result of the evaluation, but at the same time they couldn't feel as part of that process. The more involved he is, the more familiar they are going to feel with the evaluation. It was important, the relevance of the evaluation, that is to know how to ask an important question that takes into account the demands of the managers. This is key for the evaluation. Very often the evaluation is not used because we answer questions that were not asked, or questions that are not relevant for that particular moment in time. It is important to adapt the questions with the time. And this leads me to the next bullet point, which is the time. Time is a very important variable. An evaluation that you hire externally takes longer, sometimes 1 year, to get to know the results. And within 1 year, very probably the questions that are relevant today will not be relevant within a year. So we have 3 different times. The time of the policy, to know the questions that are relevant to that policy, particular policy, or the time to implement the technique or the methodology, and a third time, which is the time of the management. We work in the public administration, and you know that we have a process to follow, standards to follow, to hire, etc. So these are 3 different times, and this is difficult to deal with. The use of the evaluation depends a lot on the stakeholders that are involved in the program. How can we leverage the action of those interested parties in order to defend the program? And finally, the institutional environment. The institutional environment, depending on this, in what stage of the program you are, you can have a favorable environment to be more or less influenced by the evaluation. And Last but not least, and this is the very last slide, some findings that we have identified. The main factor or influencing factor are the expectations of the research, incremental changes. They can improve the implementation. Very often these changes are requested by the political system and not by the technical system, and they promote incremental changes or incremental improvements in the different programs. Looking from the outside, this is very important. We are talking about improving these programs.
And that's something we actually observe, maybe because of the expertise we have developed, and this is in the adaptation of the capacities of those implementing agents. And they actually need to implement the program according to its design. The federal government, which is responsible for the norms of the family grant program, many times doesn't know about the capacity in the municipalities and how they can implement their policies. And it's happened that it's designed strategies that municipalities cannot implement. They have no resources to deal with that new responsibility which is put on them. So one of the things we've seen together with those assessments that actually show the limits of those implementing agents and how far or how much we can count on them. I'm about to finish, thank you. And lastly, defocalization. 2 items here I do not need to mention. I believe they speak for themselves. Accountability and the advocacy for the programs. And with that, I come to the end of my presentation. Thank you for your attention. I thank you. I know we've been for 8.5 hours here together. So whenever we speak about methodologies or experience, the context actually does make a difference. Part of what Alex told us is the context in which we carry out the evaluations. You can then imagine the amount of variables, and I know that each of us who actually deal with continuous policies notices the difficulties we have here. I suggest we have 2 more people, Cecília and Luciana, but they actually told me that each will take 10 minutes so that we can have a Q&A sessions in the end. Luciana, please, the floor is yours. I had promised 15 minutes. I've been promised 15 minutes, but it's okay. I'll try to be brief. And I think the good side of this is that we are in agreement. So many of the things that I was about to say, Alex has already told you about them. So you will be able to see the info also on the screen, and I will be able to actually get to the point. I have 3 divisions in my presentation. First, I'll tell you about what's this Cistern or tank program, which is maybe quite familiar for people from Africa, and I will tell you about also the evaluations we carried out. And we are talking about research that was carried by SAG or that were hired by SAG. And I will tell you also about recommendations and assessments, and we will see how they contributed to the implementation of the program. And in the end, I will try to tell you about some specific bullet points and see how these evaluations influenced the Brazilian programs, and especially I am talking about these Cistern or tank programs, water tank programs. What's this Cistern program? This is simple and low-cost technology which is used to actually capture rain, especially in those municipalities that are under drought conditions. which is usually in the northeastern parts of the country. Where do I point to? So it's a simple technology to capture an amount of water, especially in those regions that undergo drought conditions, which has a very low cost. So they actually use a system to capture water in this cistern through gutters. They have a 16,000 liter capacity, and this capacity supplies the need of an entire family of about 5 people during 8 months of drought. The program has 3 modalities. The first is called First Water, which focuses on capturing water for human consumption. The second is Second Water, which aims at capturing water for agricultural production and for livestock. And the third is Tanks in Schools, which captures water for human consumption and also for vegetable gardens in public schools. So what's the target audience? We are talking about families in rural areas in the northeastern part of the country, which receive minimum income of 1.5 minimum wages or a maximum of 3 minimum wages, and we give priority to the people who are included in the family grant program, which is the program that Alex presented before. As of 2011, through a presidential decree, it started belonging to a program which is called Water for Everyone. That's a program that was designed to actually offer access to the needy population that actually lives in these rural areas in Brazil. And also, this is part of a program of no poverty in Brazil, which was presented during lunch break. And this is for the productive rural inclusion. How is the program carried out? So we transfer resources from the federal government through agreements to the municipalities or through agreements through NGOs. And a participant is the institution that we call ASA, which is the articulation for semi-arid regions, which actually gathers more than 1,000 NGOs in the northeastern part of the country, which carried out this type of work even before the Cistern program as a federal program. Here we have the figures. We had an average of 47,000 tanks built since 2003 until 2010. In 2011, when the Cistern program joined the Water for All program or Water for Everyone program, which was created through a decree, we had a high increase and we reached 360,700 cisterns in 2011 until August of 2013. So this is a quite recent figure. It's quite updated. That's a picture of one of those water tanks. So today we have that figure, and then the overall figure from 2003 until 2011 and until 2013, we have an overall of 695,700 water tanks. And now we have the program itself. I will begin with the evaluations that we carried out within the program, but I would like to give you some context before about the place in which the program was when we started preparing this presentation, and the political context is very important here. 5 minutes? Okay. In 2004, the Ministry for Social Assistance was created, which was the result of three organizational structures coming together. We had the Ministry for Social Assistance and that for Food Assistance, and we had a secretariat that took care of the Family Grant Program. So we're talking about three types of organizational cultures that were unified in one single ministry to actually deal with these policies and also with these very poor people. This, in fact, is important because it deals with the organizational culture, with interferes in the use of the evaluation and the different types of demand per evaluation, also regarding the methodology. The subject of hunger actually became part of the public policies at federal levels as of 2003. Of course, there were several actions that were not that structured in municipalities and states and in the federal government, but as a public policy, it came into our agenda in 2003, which actually created a big difference. Talking about the ASA, which is an articulation for the semi-arid region, which gathers more than 1,000 NGOs, which is the main responsible department for actually working with these water tanks in that northern part region. And the semi-arid region includes 1,133 municipalities in 9 states, and only as of 23, with the formation of the Ministry for Social Development, and after with the Zero Hunger, that program which was seen as a part of the public policy, the MDS started financing this program, and with the financing of these water tanks, we started having the need of assessing, evaluating where we are, where we're going, and what's the demand. So that's how the evaluation started arising to answer these first questions, and we see that these evaluations actually have an incremental use. And then we started assessing that there was a need to have better knowledge and to see what was the dimension, the size of this water tank program, and where we're going. We have here a series of evaluations. We have 4, which was first water, the first part of the program, and 2 other evaluations in the program, second water for production. Generally speaking, we have studies and research of qualitative and quantitative methodologies, and the ASA, in 90% of the cases, we hire third-party research, but at the same time, they require internal monitoring, so the ASA has a qualified team which is always following up the work of these third parties, which actually does make a difference, especially when we talk about quality of data. So this team actually follows everything up since the hiring of the research until the research is developed, then in the fields, and after always receiving that database, we always work with consistently, which creates a difference regarding credibility and the consistency of data. The main goals, which is to analyze the demand, the coverage, and also the focus of the program, the technical evaluation of the water tanks and the impact for those families that are benefit, the quality of water, the perception of those benefited by the program, how has the program changed their lives, and also the selection and training of those beneficiaries who use these water tanks, sustainability of the program. And we worked with samples in the municipalities and the realization or interviews with families, the beneficiaries, with representatives of the NGOs and the ASA who were working in those locations. Here we have some findings, results, and recommendations. Generally speaking, families are very much satisfied with the program. The family profile is actually of a needy family, which is extremely poor, and the focus of the program and its level is quite good, but on the other hand, part of the families who need that are actually outside the program, and there was a need to expand the program. And the evaluation that the size of the tank was not enough for a 5-member family was not enough, so we needed to consider one extra water tank or maybe increase the capacity of the tank. And the water was not actually properly treated, and they did not know how to actually treat the water for human consumption. So we needed to reinforce training with the families, and also regarding water quality was the same thing. We had a betterment in the quality of life, especially regarding healthcare conditions, and there was a reduction in the number of illnesses connected to contaminated water. And we had an increase of free time for children and adults because, of course, many people needed to walk long distances in order to gather some water, so that time was reduced, and the family had more time to be with their families, their children, and we also worked together with the states and the governments, which actually meant that we needed to actually have some care in the states that had more demand of these water tanks. And the conclusion is that the water tank is a technology which is easy to apply and that actually bears a low cost. The evaluations in the program, which is called One Land, Two Types of Water, which was a water tank for human consumption. And as of 2008, the government started financing not just water tanks, but also for the production, the agricultural production of the families. So we also had a qualitative evaluation of the program. And we also had an evaluation of the final impact that ended in 2011 in order to have a baseline to organize the next survey next year. These are some matters regarding the question itself. How did the evaluation influence Brazilian programs? Talking about the Family Grant Program. In its beginnings, it had some resistance both from the media and the middle and high classes in Brazilian society. And in fact, with the service and the demonstration of results, even those made by third parties such as the World Bank, we started removing a series of myths regarding the Family Grant Program, and it acquired legitimacy regarding its defects and impact, demystifying the effect and the increase in birth rates among women, and also showing its impact on the level of focalization in families, so that this program actually became quite legitimate. Another thing is that as of the moment that you can demonstrate the results of the program and their impact, and when you do have an impact in that type of public which is extremely poor, that creates more opening for an expansion of the program and also for the program to receive more resources. So the programs of the Ministry for Social Development had a huge increase in their resources in recent years, and part of that phenomenon has to do with that demonstration of results that the programs have actually reached. This vision we have in ASA that the research needs to be incremental. It needs to, in fact, be useful for the improvement and to correct the direction of the programs. So we are always quite tuned in and always talking to the technical departments to actually see what are the real demands, what are the questions that require an answer in due time. As for this program, the first evaluations for the time program focused on the structure, the design, the focalization, and the coverage of the program, especially because at that specific time, those were the main demands. The program was in its initial stages, so there were a series of programs regarding what's the stage in which we are right now and where do we want to go. So the ASA, together with the political managers, we needed to actually try and answer these questions. Most of these bullet points here are some challenges, and the complexity of the social programs we have today is presented in the design of the evaluation itself and the way it was conducted. And there is a difference in the technical times and also the administration and the political aspects. And when we talk about the technical aspect, we are not just talking about the time it takes for the research, but also the internal time and how the technicians take time to actually carry out these evaluations in the ASA. The evaluation receives the influence because of the decision and also because of the location of the managers, and regarding this last location, that has to do with their background, with the level of information they have in those locations. And I think that in the case of the policies for nutrition and food safety, this gathers the government and the civil society, and this presents demands. And there are a series of challenges, but I'll have no time to present them because my time's up. So I try to present to you the main issues, so if you have any questions, I can answer them later. Thank you. Okay, we were informed wrongly about the time we had for each presentation, and unfortunately the room needs to actually be left at 6 p.m. So unfortunately we will not be able to go to the third presentation, but I wanted to ask you if we at least could have 2 rounds of questions. We promised to have her presentation available for all of you, and maybe we can have 2 rounds of questions so that people or lecturers can answer questions. We have one more example about how we deal with this research and these assessment activities in public spheres. I would like to ask, do any of you have questions? Do you feel curious about what we presented? And I'm going to select 2 rounds of questions with 3 questions each. Let's start here. Okay, please raise your hands and I'll say who are the first 3 persons who can answer. 1, 2, 3. That's the first round. And 1, 2, 3. That's the second round of questions. And our friend will be left for last. I am part of the Health Secretariat of the municipality in São Paulo, and I want to know, when you receive that data bank from these research institutes, do you work with an analysis, or that's also part of the initial order? Second person, please identify yourself. Let's have the 3 questions first so that people can answer all of them. Our colleague here.
Thank you. My name is Bowen from the Public Service Commission South Africa. I just want to know what is the theory of change of the program.
Okay.
The first one, the first presentation by Alexandro.
The first one. And she was the third.
Thank you. I have one question for the presentation on Bolsa Família. In terms of the codependent variables, you spoke of interested actors and adverse actors. I wanted to know whether or not consideration was given to neutral actors and whether there was a strategy to bring those neutral actors into that equation, to either get them interested, to get them interested, not to get them to be on the adverse side. And in terms of the Cistern program, whether or not this program was in any way influential or provided you with getting closer to achieving your Millennium Development Goals. I see that there were quite a number of achievements, but to what extent was that useful in the achievement of your MDGs? Thank you.
Ok, Alexandre.
Thank you for your questions. The Secretariat in São Paulo, when we hire research, we have several ways in which we can hire them. We can either hire a full package, and we deliver a sample for the analysis, or we can actually slice that, so to speak, so that we can only hire the activities in the field and after the analysis. What determines if we buy a full package or a different one? First is the market analysis of those companies, if they are competent and if they have the necessary knowledge of that specific field. Sometimes the theme is so specific that that capacity is not really in the field. It's in the university, and that actually, it makes no sense for you to have a hiring process once you know exactly who is the person and you have identified the location. So we have those two ways in which we can hire those services. The theory of change of a research or the family grant program. The program uses the premise that you have two types of movement. The first is short term, in which you transfer income, which would promote or alleviate extreme poverty situations, and with that alleviation comes with a multidimensional poverty. And that's why the family grant program is seen as an entry door or as a social protection for goods and services that can guarantee the improvement of quality in lives or those benefited people, and that in the short term. However, you also invest with the conditions of healthcare and education to increase the capacity of that family and also the knowledge of healthcare notions of that family. And those children in those families will have more conditions in the future to have better working conditions, and they will have better wages, and with that they will be in a better position in the society, so to speak. As for the players, if we consider neutral players in the analysis, generally speaking, when you have an evaluation, you consider neutral players, and you have a tendency to consider neutral players as those favorable for the program, and we tend not to consider those adversaries. And when not considering that, first, your evaluation will be very difficult, because they do tend to criticize the evaluation, and afterwards you'll have problems with credibility. If your evaluation is positive, you'll have credibility programs. That means you will need to talk to them so that they can be included in that process, and with that they can actually make necessary criticism, and that critique many times is out of the question, because those players, those adversaries come in different packages, so to speak, so you will never be able to convince them and tell them that that variation is quite credible, because their motivations are different. But there is a group of adversary players that you can convince if you simply incorporate them in the process.
About the targeting of the social protection programs. I know education and health, that's universal coverage, but in terms of the in-kind and cash transfers, how do you ensure that the people who need that service or benefits really receive them? And then what has been the impact on the inequality situation in Brazil as a result of these social protection programs?
Sorry. He's first.
Je tiens à remercier les différents intervenants et je vous signale que moi j'avais l'opportunité de prendre connaissance du système en
know the
2010.
system in 2010 thanks to our colleagues from the PNUD Brazil and from the Ministry of the Social Development. In Morocco, we are putting into place a mandatory system too, with a registry, and we are faced with a problem similar to yours, how you regroup all the data that you have, because what we realize in our countries is that some transfers are made between families, and how this transfer is made to assess the situation of families. So that's one issue. Another question that we have is mobility of individuals and also households, because we have a system per region or state, and we have the scattering of households and households who move from one area to another. So have you found solutions to that problem in Brazil? Thank you. We have two other persons.
Tenemos dos preguntas rápidas porque si no, no podremos cerrar la sala. We have 10 additional minutes, otherwise we'll not be able to come to a close. We have 2 more questions here, and afterwards we can have direct questions outside, please. To ask and say that 80% of surveys that are carried out or are hired, you presented that, and I would like to know the financing methods for those evaluations. If the ministry actually carries out more sectorial evaluations, but I would like to know through the ministry if there is a fund, and a specific fund for each program, or is it an amount that's actually considered by the ministry. I would like to have a general idea about the process.
One small question. I'm thankful for sharing your experience, and I think it gives us a lot of food for thought. This fun little thing on the codependent variables, I would like to know how you made the institutional environment favorable for this valuation.
Thank you. My question is to Mr. Pinto, and this is not a question about evaluation, it's a question about the program. Now, any conditional cash transfer success is truly dependent upon beneficiaries having bank accounts, because I presume that you are making direct bank transfers into their bank accounts. So my question is the following. The program started around 2004, and from Bolsa Scola it went up to Bolsa Família. The coverage increased dramatically. What fraction of the beneficiaries then, at the beginning of the program, had bank accounts? And as coverage increased very sharply and rather quickly, today what proportion of all households have bank accounts, and how have you managed to incentivize banks to reach out and open accounts? Because clearly in a vast, geographically vast country, it's next to impossible to open physical branches. So there must be a mechanism, modality that you must have used. And what was that modality, and how in a country where most of the banks are private banks, did you incentivize them to actually enable that to happen?
Thank you very much for your comments and questions. I'm going to start by answering the last question. Bank account is a very large question. The Brazilian banking system has a lot of branches. I mean, we have branches, but not only branches. We have bank services in all the municipalities of the countries. This is one characteristic of the country. There is only one municipality with no bank services. We have over 5,000 municipalities. There is only one municipality there is no single municipality with no banking services. So we have Caixa Econômica Federal, which is a public bank. We have an agreement. There is an account. We have an account only for receiving this benefit. This is not an usual bank account. Once the family is registered after the criteria, they issue a kind of credit card, a plastic card, and by using that plastic card, they can go to a accredited branch, credited by the Caixa Econômica Federal. Sometimes it is not a branch, but a correspondent. It can be even a supermarket, for example, could be, or a store, or a lottery house, and the beneficiary can draw the benefit. So it is not necessary that they have a bank account the way we know it. They can use, or they can get the benefit by using that plastic card. However, the program is fostering, we have an incentive line in order to foster the bancarization of the beneficiaries. I mean, in order that they can use the banking services in order to increase the coverage and those services in order to increase their own well-being. Once the Bolsa Família program, for example, if the household didn't draw during 3 months the benefit, at the 4th month, the benefit comes back to the government, to the national government. If they have a bank account, the benefit is going to be deposited at the bank account, and it is not returned to the national government. What is happening today? We have made some changes because of, or following a recommendation of the Court of Accounts. It is not necessary to return the benefit, but after 6 months, if the benefit is returned, this could be an indicator that, for example, a member of the family died or something like that. So the ministry has incentives by means of some financial and banking inclusion measures. These are low-income beneficiaries and low school level, and they are not aware, they are not familiar with the banking services. They don't know how to use them. It is necessary to have an action specifically in terms of financial education. I couldn't have time to show it, but one of the surveys that we conduct was exactly to get to know what kind of knowledge do the families have about banking services, if they pay the fees, what the difficulties that they faced, etc., in order to foster this policy by the ministry to develop a training program for the beneficiaries. Funding of the service or the evaluation. How do we fund the evaluations? We belong to the Secretary of Evaluation and Information Management. I didn't say that here because I'm going to speak about that tomorrow. But they have the same status of other secretaries. That means that we're autonomous, both administratively and financially speaking. So we have a budget for evaluations within the secretary. This is not part of the resources coming from the programs. This is a specific budget for evaluation. And within the secretary, we have a mechanism that I'm going to present tomorrow, and we define what programs are going to be assessed or evaluated, how we define the evaluation agenda of the different programs. So with this fund, we feel comfortable in order to define the evaluations that we want to carry out. Mobility of individuals and households. This is a problem that we really face. We know that low-income families are very unstable just because they don't own, for example, the land. They live in very needy regions, in very poor regions around the cities. This is very common for sure. And the best partner that we have in that regard are the municipalities. So we cannot use via the government, national government. That's why we use the municipality in order to update the registry. So the municipality, the city hall, is the state. Locally speaking, they are closer to the individuals, and they are able to know what is going on in terms of mobility. For example, the municipality of São Paulo, they get to know that there is a location where there was an invasion, for example. The bigger, the larger the city or the municipality, the more difficult it is to control that. But in smaller municipality, it is more appropriate. Once the family made a change, they can get in contact with the municipality and say, listen, I was in Fortaleza, for example, in the Northeast, and now I'm living in São Paulo. And the municipality of São Paulo, through the system, through the registry, they can retrieve the data of that family, and this family is going to receive the benefit in São Paulo. The target audience of the program. How can we reach this target audience? Once again, by using the municipalities. They are our operational arms. We have different service made by the national government showing that an important part of low error in terms of registry is due to the setting of quota and based on the fact that the municipalities are responsible for including the beneficiaries in the national registry. There were other questions, guys, but in terms of time, we don't have time enough to answer them. Well, they gave me a couple of minutes. The impact of the Bolsa Família program in reducing the social inequalities in Brazil, or social inequalities in Brazil. We have had, historically speaking, very high inequalities levels. I don't have the data right now, but they have been reduced drastically in the last years. And this reduction, this fall, according to a survey, by the way, their cost, this reduction is caused by a policy of increasing the minimum wages. Starting in 2003, we have been setting an increased policy for minimum wages. Secondly, caused by the BPC program. This program is another income transfer program that we didn't mention. This is for families with elderly families with up to minimum wages, with elderly people or people with discapacities related to the labor market. And the third is exactly the Bolsa Família program. BPC, that program has a budget similar to the Bolsa Família, but of course the number of beneficiaries is very small. That is 2.8 million beneficiaries of the BPC program. So comparing both, the amount of the transfer is larger compared to Bolsa Família. Okay, it is now 6:10. They gave us 10 additional minutes. Thank you very much for your attention, and we hope that our presentation helps you better understand the evaluation process for public policies in Brazil. And I hope that we helped to illustrate by our experience to answer this experience, how the evaluations can influence the Brazilian programs. They influence by helping in the context, by helping finding solutions of improving programs. And the evaluations show new situations, new experiences. Once again, thank you very much, and I hope to meet you outside in order to tell you more stories. Thank you.